Hello everyone, I'm Dr. Manisha Singh, consultant gynecologist and infertility specialist at Pristyn Care, Gurgaon. Today I will be discussing about miscarriages. A miscarriage is a spontaneous loss of pregnancy before it is viable, that is before 20 weeks of pregnancy. According to ACOG, around 10 to 15% of pregnancies end up in miscarriages, which is quite common. At the same time, it can be a very devastating and traumatic experience for the women. The risk is around 10% for women under 35 years of age, and as the age advances, the risk goes on increasing. It can be as high as 45% in women over the age of 40. Now, the miscarriages can be of several types. It can be a threatened miscarriage. In this case, the loss of pregnancy has not yet occurred, but there are signs and symptoms of a miscarriage like vaginal bleeding, lower abdomen pain, or backache. Then it could be a complete miscarriage where all the products of conception have been expelled. It could be an incomplete miscarriage where some products of conception have been expelled while some are still in the uterine cavity. Next is missed miscarriage. In this, the signs and symptoms of a pregnancy loss are not there, but the cardiac activity of the fetus ceases to exist. Then another type of pregnancy loss is recurrent pregnancy loss. In this case, there are two or more than two spontaneous pregnancy losses. Recurrent pregnancy loss is a very traumatic and devastating experience for the women. Coming on to the causes of miscarriages. The most common cause of a miscarriage is genetic. That is, if the embryo is not healthy, if it is not euploid, it will result in a miscarriage. Another very important reason of miscarriage is uterine abnormalities. Third important cause of miscarriages is endocrinopathies, which are uncontrolled, like uncontrolled thyroid disorder, uncontrolled diabetes, PCOS. Another important reason is infections, then uncontrolled medical diseases in the mother. Coming on to the diagnosis of miscarriage, TVS, that is transvaginal sonography to confirm the miscarriage, HCG levels, and a pelvic examination to see whether the cervical os is open or not. Now moving on to the treatment and prevention of miscarriage. First of all, planning pregnancy at the right time is extremely important. As we have discussed earlier, that the risk of miscarriages increases as the women's age advances. At the same time, optimizing the weight, that is being extremely underweight and being overweight or obese, is a risk factor. Smoking, use of illicit drugs, and alcohol can also result in miscarriages. The control of any endocrinopathies is important. Optimizing stress levels is important. Now coming on to the treatment of miscarriage. Once the miscarriage is confirmed, if it is incomplete abortion, usually medical treatment can be tried, but if it fails, we might need to resort to a surgical evacuation of the retained products of conception. In case of missed miscarriage, also the medical management can be tried first, and then if it fails, we need to resort to surgical management. In case of RPL, a comprehensive and thorough examination of all the causes is very important, and in certain cases where the cause might be a genetic abnormality, we might even need IVF with PGS or PGT.
Book your surgery appointment on pristyncare.com. Pristyn Care.